Getting inhaled insulin shouldn't be so difficult. Haven't we all wanted a non-invasive insulin for 100 years? And here it is. And doctors and health insurance companies are still reluctant to let you use it. I've lived with type 1 diabetes for 25 years. I took approximately 55,000 injections during those first 25 years. If it wasn't for inhaled insulin, I'd be facing another 25 years of 55,000 more injections. If we have a non-invasive insulin option, this should be available to anyone who needs insulin. You would think that doctors and health insurance companies would understand how life-changing this medication is. Doctors are still reluctant to prescribe it because it's relatively new and they don't understand it. Health insurance companies don't want to cover it because it's still relatively new and they already have these cozy relationships with the manufacturers of injectable insulin from Big Pharma. And MannKind is a small pharmaceutical company. They haven't worked their way into your insurance formularies. They don't have that cozy relationship with the pharmacy benefit managers who negotiate between the drug maker and your insurance company to decide which drugs will be covered in that formulary. If you are trying to get insurance coverage for inhaled insulin, this is what you need to know. First, if possible, use an endocrinologist to write this prescription instead of using a primary care. Primary cares can write these prescriptions, but endocrinologists are better at dealing with prior authorization paperwork. I've gone both routes, and my primary care is the first person that was the most willing to write a prescription for Afrezza, but my endocrinologist was better at dealing with the paperwork. I hear from so many people with type 1 diabetes saying, I want to try inhaled insulin, but my doctor won't even prescribe it. If you are in that situation, I suggest you go find a new doctor. It is ridiculous to not let someone with diabetes try inhaled insulin just because it's new, just because the doctor doesn't understand it. Once you have your doctor on board and they are willing to write that prescription, don't let them just send that prescription to your local pharmacy. It will get denied and then you'll have to do a whole bunch of steps. And if you don't do those steps perfectly, your case will be closed and that's that. Your best chance at getting insurance coverage for inhaled insulin starts with following these steps very carefully. First thing is that you need to have certain things documented in your personal health record. Without these things, you will get rejected for inhaled insulin. Your doctor needs to write in your record that the other methods of taking insulin via injection, pen, syringe, or insulin pump are not tolerable for you. And that can be for any number of reasons: injection fatigue, extreme damage to your skin, reluctance to take your insulin because of the pain of injections. It doesn't have to be complicated, it just needs to be documented. Tell your doctor you're tired of taking injections. Who isn't? Who isn't tired of taking insulin injections all day long? That should be in all of our medical records. Next, your doctor needs to document that you do not smoke cigarettes. Easy enough, as long as you don't smoke cigarettes. And lastly, this is really important. Your doctor needs to document that you have lipohypertrophy. Lipohypertrophy is basically significant damage to your skin from lots and lots of injections. Lipohypertrophy is scar tissue and hard lumps of fat that develop from taking lots and lots of insulin injections. We all have some degree of lipohypertrophy, but we don't usually talk about it to our doctor, so it never ends up being documented in our health record. You probably also have bruising and scars and more bruising and painful bleeding from all your injections. Your doctor needs to document that you have lipohypertrophy on your medical record. Some doctors will require you to do a lung function test, a pulmonary function test. This is not required. It's just a suggestion when you start Afrezza. I never had to do it. If you have relatively healthy lungs, there's really no reason you should have to do this. Okay, once you have all of those things documented in your health record, the next thing is to make sure that that prescription goes to the right place. Do not send that prescription to your local pharmacy. It won't work. That prescription needs to go to Sterling Specialty Pharmacy. There's only one in the country. That's where it needs to go. Sterling Specialty Pharmacy works with MannKind, the makers of Afrezza inhaled insulin, to process and manage and distribute all of the prescriptions for inhaled insulin. Sterling Specialty Pharmacy has been so good to me. Their customer service is awesome. I mean, truly awesome. They are efficient, they're friendly, they want to help you get your medication. They also ship FedEx right to your door, so you can order your insulin on a Monday and it shows up on a Tuesday. I have really enjoyed being a customer of Sterling Specialty Pharmacy. After your doctor sends that prescription to Sterling, they're going to help your doctor work through the prior authorization paperwork. You will not get approval right away for this drug because the insurance companies just don't want to pay for it. They don't want to deal with it. They want you to go use the insulins that they already have those cozy relationships with the PBMs. If your doctor does all of that prior authorization paperwork and you still get rejected, the next thing you do is very important because in most cases with most insurance companies, you only get one chance to appeal that rejection of the prescription that you want coverage for. So make sure and prepare your doctor for the fact that if you get rejected, they shouldn't just, submit the same paperwork they submitted last time. They should talk to you and make sure that they've got all of the details that your insurance company is saying they need. If your appeal gets rejected, your case gets closed. And then you're just done. Your insurance company won't even listen to you try to explain again why you need this medication. This just happened to me. I recently had to switch health insurance companies. And sure enough, my first attempt to get coverage for a medication I've been using for 3 years was denied. My primary care didn't send them the exact details they wanted because he didn't have it in his notes that I have lipohypertrophy. My endocrinologist had it in her notes. So he sent them a little bit more paperwork, but it still got denied because it didn't say Ginger has lipohypertrophy. I've taken 55,000 injections. I definitely have a lot of damage at my injection sites. Who wouldn't? So I got denied coverage. And that was it. My case got closed. And I said, hey, endocrinologist, will you send them the documentation of my lipohypertrophy? And she did. But they had already closed my case. So they didn't even look at what she sent. Talk about frustrating. Meanwhile, fortunately, when you get rejected by your health insurance for inhaled insulin, MannKind has a program called Afrezza Assist. This is their patient assistance program. They will sell you a month's supply of inhaled insulin for $99 a month. I think it's a little more if you use very large quantities of Afrezza. For the amount I needed, it was $99 a month out of pocket. So I did that for 1 month. I got the Afrezza I needed so that I didn't have to stop using it. And then I set my sights back on my health insurance company. $99 isn't a crazy amount, but it's a lot more than the $35 copay that I would be paying if I had health insurance coverage for Afrezza. So here's what I did next. I found a personal contact at my insurance company by digging and researching online. I reached out and I said, hey, I've lived with type 1 diabetes for 25 years. I've taken 55,000 injections. This is a relief. This is life-changing. Please reopen my case. Please look at the documentation my endocrinologist sent that says I have plenty of skin damage from 25 years of insulin injections. So I was a human being talking to a human being instead of talking to some prior authorization computer process where people are just checking boxes and they don't have to stop and think about you as an individual human being with this really intense disease. And guess what? They responded. They reopened my case. They contacted my endocrinologist. They accepted her documentation of my lipohypertrophy, and I got insurance approval. If you do get insurance approval and your copay is higher than $35 a month, go find MannKind's copay card. They will make sure that copay comes down to $35 a month. Getting this life-changing medication is not easy. You have to be persistent, you have to be smart, you have to advocate for yourself. Nobody at this point in time, including many doctors, are going to just say, yep, I'll write the prescription. Yep, we'll cover it in your insurance plan. You have to fight for it. I wish it wasn't like that. It shouldn't be like that. I do know that the people at MannKind are working very hard to try to get Afrezza more widely understood by doctors and more widely covered by insurance companies. But they're fighting an uphill battle because it's a really new medication and they are a relatively small pharmaceutical company. They are not big pharma. So please, to the people at MannKind, keep working your work. Thank you so much for this medication. And if you're trying to get it, don't give up. Be persistent. Thanks for watching Diabetes Nerd. Don't forget to subscribe, like this video, and leave a comment. Find my books on Amazon.